Welcome viewers. In this video, I will be talking about the moles and the distinguishing points between a benign and cancerous mole. A brief introduction is required here to fully understand the topic. The medical term for a mole is nevus. A mole or nevus is a benign melanocytic tumor, meaning a non-cancerous skin lesion that develops from pigment producing cells of the skin called melanocytes. Also, otherwise known as beauty marks, the moles are not usually present at birth but begin to appear during childhood, the teen years, and new moles may form until about age of 40 years. By the time they are adults, most people have between 10 and 40 moles. Moles may change in appearance over time and some may even disappear with age. You are seeing in this view a benign mole which is round to oval and symmetrical. By symmetrical, it means that if one draws an imaginary line through the middle of the lesion, the two halves appear equal. They are usually smaller than 1/4 of an inch in diameter, equivalent to the size of a pencil eraser. The color of a normal mole is generally a uniform color throughout. They can be brown or black or pink. Benign mole, as seen here, have a distinct border separating the mole from the surrounding skin. A benign mole does not show any change in size, shape, or color with time. Any such change in a mole should arouse suspicion and examine for malignant change or cancer. Now, I will be discussing about the malignant melanoma, the cancerous counterpart of a mole. As you will be seeing and noting here in this part of the model, the malignant or cancerous mole looks quite different from a common benign mole. There are some points or signs which can help to differentiate a benign mole from a cancerous mole. If one draws a line passing through the midpoint of a mole along any axis, the malignant moles exhibits asymmetry. That is, if you draw an imaginary line through the middle of the lesion, the two halves appear different, as is seen here. It looks quite different from round to oval and symmetrical common benign mole. The second sign of differentiation is that if any mole is larger than a pencil eraser or 1/4 of an inch, then it could be cancerous. The color of a mole is also a point of differentiation. Cancerous moles are multicolored as seen here. A single mole has more than one color. The colors may be different shades of black, brown, or tan. As it grows, the colors may change to red, white, or blue. A mole of several shades that have faded or darkened is suspicious. On the contrary, as you have earlier seen, a benign mole has a single brown to pink shade. A mole darker than other moles in the same individual has more propensity to be cancerous. Any mole that stands out from the rest is an ugly duckling and should be examined further. The fourth sign is that a cancerous mole doesn't have a smooth or even border compared to a common mole. A mole that tends to have irregular scalloped or notched edges, as is also seen here, needs to be distinguished as cancerous. The changes, if any, that occurs in a mole over time is defined as evolution of a mole. This fifth sign includes changes in shape, size, or color of a mole. A mole that is evolving in the form of shrinking, growing larger, and changing color is suspicious. Besides, bleeding, itching, or crusting of the mole may indicate a cancerous mole. A cancerous mole may often grow in size or change in height rapidly. Also, a hard or lumpy elevated nodule with a central depression could indicate a cancerous growth. A healthy mole should heal quickly. If it doesn't heal within 3 weeks, it could indicate malignancy. The skin sore that heals and then comes back, or if a swab develops and doesn't heal within a few days, may indicate a cancerous mole. Now I will be speaking about some important features of cancerous mole called the malignant melanoma. A melanoma is the most dangerous type of skin cancer. Australia and New Zealand have the highest rate of melanoma in the world. Highest rates also occur in Northern Europe and North America, while it is less common in Asia, Africa, and Latin America. In the United States, melanoma occurs about 1.6 times more often in men than women. It is a type of skin cancer that develops from the pigment producing cells known as melanocytes. Melanomas typically occur in the skin but may rarely occur in the mouth, intestines, or eye. The commonest sites in female is legs, while in men they most commonly occur on the back. While most moles never turn into a melanoma, some do. Some genetic changes inside mole cells may cause them to become a melanoma cell. About 25% of melanomas develop from moles. This suggests a good proportion of malignant melanomas don't have a history of moles. This explains that benign moles in themselves are not a cause for cancerous mole. The primary cause of melanoma is ultraviolet light exposure in those with low levels of skin pigment melanin. The ultraviolet light may be from the sun or other sources such as tanning devices. Using sunscreen and avoiding ultraviolet light may prevent melanoma. Besides ultraviolet exposures, individuals with increased number of moles, individuals with history of affected family members, and those with poor immune function are at greater risk. Treatment for most malignant melanoma is removal by surgery. Most people are cured if metastasis or spread has not occurred. Metastasis of early melanoma is possible, but relatively rare. Less than a fifth of melanomas diagnosed early become metastatic. Brain metastases are particularly common. Melanomas can also spread to the liver, bones, abdomen, or distant lymph nodes. Metastatic melanomas may also cause non-specific symptoms called paraneoplastic symptoms, which include loss of appetite, nausea, vomiting, and fatigue. For those in whom melanoma has spread, immunotherapy, biologic therapy, radiation therapy, or chemotherapy may improve survival. In the end, I am summarizing the points of distinction between a benign and malignant mole. For identification of malignant melanoma, the mnemonic for identification of malignant melanoma, the mnemonic A, B, C, D, E can be helpful, where A stands for asymmetry, B for border, C for color, D for diameter, and E for evolution. This mnemonic does not apply to one of the second most common variant of malignant melanoma called the nodular melanoma, which has its own mnemonic EFG, where E stands for elevated above the skin surface, F stands for firm to touch, and G stands for growing. Now, dear viewers, I will be discussing some points about how to screen cancerous mole at home. Here are some tips for screening moles for cancer. Evaluate your skin once a month regularly. Check your entire body for moles or suspicious spots starting from the head and working your working your way down. Check the hidden areas of the skin, especially between fingers and toes, the groin, soles of the feet, and back of the knees. Include your scalp and neck. Use hand mirrors for difficult areas or ask help from your family members. For checking evolution of moles, take, pho- take photos of the moles and monitor them regularly. Be cautious about a newly developed mole. If you are a teen, pregnant, or going through menopause, then you are at a labile age for moles to undergo malignant change. So, viewers, hope this video would have been helpful to you to understand the distinction between a common benign mole and a cancerous mole. Do like, share, and subscribe to my channel to encourage me to post similar informational videos. Thank you.